The next award is Dr. S.S. Sidhu Award, and this award was instituted in the year 2013 through a donation by Dr. S.S. Sidhu, Fellow of the Academy, for best published, unpublished research work in the field of orthodontics and maxillofacial orthopedics by a clinical investigator. And this year it's been awarded to Dr. Virendra Singh, who's professor at the Department of Oral and Maxillofacial Surgery, Postgraduate Institute of Dental Sciences, Rohtak, Haryana. Dr. Virendra Singh.
Thank you, sir.
The award was instituted in the year 2013 through a donation by Dr. VINOD Kumar Bhargava, the Fellow of Academy, for best published or unpublished research work in the field of clinical pharmacology or Department of India Drug Development in India for biomedical scientists below the age of 45. This year, the presenter is Dr. Velpandian. He is additional professor in charge of ocular pharmacology and pharmacy at the RP Center of AIMS, New Delhi.
Good morning, respected chair and the experts. And I thank Academy for choosing me for this award. I am honored. This work, what I am going to present here, is part of new drug development protocol which we have been following for post-menopausal dry eye. As when we started looking into the dry eye, I think most of you know about what is dry eye, but what is something missing so far is that the drug. So far we have been treating the postman of any dry eye, we just give artificial tears. Our tear substitutes, they lack any active ingredient in that. But when we just looked into the sub-classification of people, those who are suffering from dry eye, we found aging. Aging is a process in which both men and women suffer from this dry eye, and we just got into understanding about the principles and the pathology underlying with this condition, and can be able to develop something to deal this process. So the dry eye is a little more complicated one as than we think of. Here, aging is a phenomenon in which low androgen levels have been implicated in a complex situation where leading towards decrease in tear film or tear film deficiency. It could be due to the lack of lacrimal secretion or decrease in secretion, or could be the lack of the tear film is having one small monolayer of lipid. Let me just show you a better picture. This is the outside the cornea. You just take out the tear film. It's a 7 micron thickness tear film. Outside the tear, you have a half a micron thickness of lipid layer, which is preventing the water from evaporating into the atmosphere. So the desiccant condition is getting prevented by this monolipid layer. But the lipid layer, just if you put a drop of oil on water, it won't be able to make a uniform film because of its surface tension. Here, it's a very complex process. The lipid is not that simple. We have amphiphilic lipids in the interface between the lipid and water, and more hydrophobic lipids outside where we have the lipid to air interface. So thereby, it's trying to decrease the amount of water being evaporated. So here the problem is, any problem comes to the tear secretion, the amount of tear which is getting secreted, or to this roof which is protecting the evaporation, can lead to dry eye. Now the question is, okay, this lipid is coming under which influence? Is it getting modulated along with the age? Yes, we know very well that the hormones are drying out, or the levels are decreasing along with age. In case of male, we know that the testosterone levels are progressively going down. But typically we have the scenario after menopause. Most 61% of women face with this dry eye. So when you just look at a little more closely here, we have more than lacrimal gland. We have other glands of Mann's, meibomian gland, Zeiss, Mole, Cruz, and Wolfram glands are present over there, and they interplay a complex type of lipid mixture, and this is getting secreted here, which really even today we really don't know which is secreting what. But altogether, what we know is that the secretion what is having, it makes that the smooth optical lipid interface, hydrophobic barrier to prevent the tear outflow, reduce the tear evaporation during eyelid opening and when blinking, spreading and stability of the tear film over all the corneal surface, and sealing the apposed lid margins while during sleep. So these are all the functions of it. Now the vital question is it coming under the influence of hormone? So what we had is that Butovich in 2009, they proposed what you call as meibomian puzzle. So meibomian, we know that meibomian gland is secreting this oily secretion. What are its components, and what is it made up of? Really, it was a puzzling substance, we thought. The tear film lipid layer resisting on the air-water interface, mainly present in mainly prevent evaporative water loss, that has been reported. The protective efficacy of the tear film is believed to be related to the chemical composition of lipid layer. So if it is coming under the influence of hormones, definitely this lipid composition is going to change. Is it true or not? So in the dry eye in post-menopausal women is due to hormone influence that we know very well, but so far those no studies existing when we started this work in 2005. So now when we wanted to develop a new drug, we followed a strategy. We wanted to look forward for a clue how this hormone, post-menopausal women where hormones are just all of a sudden withdrawn, how this is having any direct correlation with this kind of lipid composition. This is what the vital link we wanted first. Then we wanted to lipid, in case can we able to replace this lipids to develop a drug, or we try to develop an appropriate animal model. Can we able to substitute the deficient steroid by topically? Can we able to achieve this? So this is the strategy we followed. And today in this one I'm just talking more vital one, that is the animal model, which enabled us to carry out the complete process. So here the circulating testosterone is getting converted to the active form by dihydrotestosterone by 5-alpha reductase is an enzyme. Surprisingly, we found in most of the ocular tissues we found this in good levels. And it's getting aromatase converts this into estradiol, that's a female sex hormone. Now what is the role? Now when I just try to take a menstrual cycle, that's you're having an influx of hormones, and the hormones are doing a lot of influence on the physiology. So the immediate question came to us, can we use this to prove that can the influence on the tear film? To enable this, what we have done is that we have done a tear lipidomics study. That means we did a quantitative lipidomics, and we collected of course all of them were approved by ethics committee of ours. We took 12 female individuals and we took the tear meticulously between 2 menstrual periods in every 3rd day. And we just 21 lipids, possible lipids, and including other lipids, we shortlisted, and they were subjected for analysis by using a ESI tandem-mass spectroscopy, a quantitative lipidomics. So from this study, we could get a very, very vital link. The big vital link is that, you see, this is a tear function test. What we classically use is the Shammer's test, where we try to measure the tear flow, as well as the TBUT, that is breakup time, tear breakup time, to analyze the stability of the tear. See, this is what you could see here. See the highest flow and the good tear stability. We could see in the estrogen phase, and you see again in the progesteronal phase. And the minute when you just compare it with the lipids, the total lipids, whenever we have taken out all the tears and we try to analyze it, along with the time, you see in the estrogen phase, these lipids are increasing, and in the progesteronal phase, these lipids are again increasing. We could get the vital link. Yes, it is involving, it is regulating. This is the first evidence to show that it is involving. So this is what you see here in this typically phosphatidylglycerol. This is the one which is mainly affected. You see that you can see both. It's a very high amount. It is in the tears, and it is the one which is highly influenced. When the same thing, when you just put it together upon the classical physiology picture we have about the estrogen and progesterone level, you could see this is a picture exactly coinciding with in the spiking levels of both steroids. Now what happens in case of post-menopausal dry eye? I'm not going in detail, I'm just cut-shorting my talk. to only the group which we have selected, the postmenopausal group, in which we could see the phosphorylglycerols are significantly reduced and most of the phospholipids are reduced, but whereas the cholesterol is increasing up in the tear film. This has given this has been done in about 195 subjects. We are subject for this analysis, and they have been meticulously graded. I'm not going in detail, but this has given a clue that yes, it is getting influenced, and in postmenopausal dry eye, these are going down. In that case, the tear stability could be due to that. Then the next question is that, can we be able to substitute it as a topical eye drop? If so, can we have an animal model to prove this is happening? Whether it is when the female sex steroids are having influence or male sex steroids are having influence. This is what we wanted to know, which is made into this paper, development evaluation of animal models for sex steroid deficient dry eye. So here what we have done is that the classical model for this kind of studies is that you go for ovarectomy. When you do the ovarectomy, that you're completely cut off, you try to create a situation similar to that of menopause, and that we are trying to achieve it. And after the moment when we started ovarectomy, slowly that tear secretion started lowering down. That was our first thing which you could observe, yeah, it is happening. So immediately we thought that we should have an appropriate model in case of andropause. I don't know whether it is still accepted or not, but if there is a progressive loss of testosterone, in that case, the male steroid deficiency can happen. So in that case, we wanted to have another model. So in the male rats, we treated a drug which is used for benign prostate hypertrophy, that is finasteride, and on the male rats. Surprisingly, we want to know another thing. Is it in female, is it the testosterone which is doing the job, or is it something else? So again, in the female rats, we are given the finasteride. We have evaluated the models by slit lamp biomicroscope and methyl orange coated thread method. All these methods we developed at a dew point, that is a humidity in the room was calculated basing this August Maximus approximation, and we have validated all these methods for these animal models. Because we do this in patients, we want to do in animal models, so we have done meticulously all these things. And in fact that we have done, we injected atropine. Atropine, we know that the muscarinic blocker is going to cause a frank dry eye, and we just created the dry eye to prove, yeah, these methods are working to get the analysis done in rats. See this results. It's a very interesting result. What we were getting here is, see that in the day 0 is this much. 4 or 5 days we have just done only this assessment of basal tear secretion. After that, after the ovarectomy, slowly the tear levels are going down. And on the day 60, you see that it's about 50% approximately that of the level has decreased. So we know now very well that yes, the hormones, circulating hormones, having a direct influence on them. Then we have gone ahead to the tear film breakup time. Again, in this also we could see confirm the same. To these rats, when we treated with atropine, we could not get any further significant decrease in the tear film. That shows that this, whatever which is having a reflux tear which could form here is completely masked, and it is coming under the influence of these hormones. In the sex steroid deficient animal model, when we did 5-alpha reductase, we thought that very well we'll be able to get in male rats, but male rats we were just getting very nicely that tear film is tear secretion is going down, and similarly that TBUT is also going down. To our surprise, in the female rats also we could see the same scenario. So that shows it's beyond the control of circulating sex steroids. The domination could be due to the circulating testosterone levels, and they are the one doing this miracle of reducing the tear flow when we block them with 5-alpha reductase. So when you just do the ovarectomy, you are just trying to decrease amount of testosterone which is being circulated from the ovary. That is the one could be responsible for the effect what we have been seeing so far. So we gone ahead with understanding what is happening to the receptors, sex steroid receptors over there. Again, in the same experiment in the ovarectomized animal and finasteride treated male and female rats, we have gone for quantitative PCR. In this quantitative PCR, we quantified the presence of ER alpha, beta, and androgen receptors both in cornea and lacrimal gland. So in both cases of the ovarectomized animals, you see both cornea as well as lacrimal gland, all the receptors are downregulated over the period of time. But in case of finasteride treated one, predominantly the lacrimal gland is getting affected. So we thought that, okay, let's go ahead with trying to develop a compound which is having binding affinity towards androgen. So we chose, we followed this complete phenomena. We just started this work with 800 isoflavones. We chose a very safer one. So you know that the genistein is the one which is a phytoestrogen, is very well known to people, and these kind of compounds that are known to have flavones and isoflavones do have androgenic activity. Therefore, we started computationally, we were trying to shortlist, and we got some hit series of compound. From the hit series, we made the pharmacophore optimization. From the pharmacophore optimization, we synthesized this compound in our lab. We call that as VL series of compounds. I am not going in detail with the structures, whatever we have, as they are under the intellectual property right now. We are trying to, looking for an industrial partner to go ahead with the development of this. This compound, the VL series, which we have a substituted one we made in our lab, VL1012, has been taken for further up as a topical installation 3 times a day as a proof of concept in animal model. So in this animal model, the same overrectomized animal model, we could see this is a normal tear flow. This is a control one where we have the vehicle treated one. You could see the progressive decrease in the tear flow. But when we treated with the drug, the VL series of compound, the test compound, we could restore the levels. To a good extent, we could restore it. Similarly, in the finasteride treated female rats, okay, it's not a male rat. Male rat, I have no, it's not a surprise if it works in the male rat. But in case of a female rat, again, we could restore the basal secretion of tear. So this is this could prove us that, okay, we can go ahead with further studies to know about the topical substitution of these compounds could be beneficial. So this is the animal model which we developed in this whole series of experiments. It has given a vital clue towards conceptualizing the whole series of experiment towards developing the new drug development. So I thank my colleagues, Professor Biswas is a clinical pharmacologist, Professor Titial is an ophthalmologist, Namrata Sharma is another ophthalmologist, my PhD student Smrita, she is the one who worked for PhD on this topic, and Moksha is another person who worked in this, and she's working on this for optimization of VL series of compound. And this is our working group. Dr. Nabonita has taken up this work under DST to take it up further. And this is Ms. Ankita. She's a medicinal chemist who synthesized the VL series of compound. And Anju is the one who has done a lot of lipidomic studies to understand what's happening pre and post menopausal conditions. Of course, this study would have been possible with support of my institution, AIMS Delhi, and the DBT financial assistant was of great help in developing this. I duly acknowledge for the financial help. Thank you very much for the kind listening.
Thank you, sir. Just a question. What is the prevalence of dry eye because of menopause? Or
yes, sir. Sir, although there is no such a conclusive evidence that what is the percentage of this, but the rough estimate is about 60% of the postmenopausal women 60%. Suffer from different stage of dry eye, right, from mild, moderate, and severe. And really, that there's no such a study which is so far has been done to show how much is the percentage in which age level, as that data is not that much available, but 61% is we know very well about it, sir.
The second question is, because the drug or the model that you developed, you're putting an artificial tear or a thing, it's steroid based.
It's not a steroid, that's what the important thing, sir.
But did you study what is happening in terms of glaucoma to these, in the rise of these rat model that you've developed?
Very good question, sir. So actually the steroid model, if we are having the phenanthrene nucleus we have, which is similar to that of corticosteroid, that would be expected to have these kind of side effects on glaucoma, raising the intraocular pressure. Therefore, the skeleton what we chose for our experiment is a phytosteroid, that is the phytoestrogen that is having this a typical structure of flavone structure or isoflavone structure. So we chose that structure so that we don't have a structural resemblance that of corticosteroid type of compounds.
But did you look at the pressure in the rat model?
Sir, this is coming up in the scaling up series. We are trying to do it for the toxicity studies, in which we are planning this to do in higher animals, because a rat intraocular pressure is very difficult to monitor, sir. We are trying to do it in rabbits.
Any other questions?
Yeah.
Yes. Please introduce yourself when you ask the questions.
Morning, sir. This is Apurva.
Please.
So I want to ask that in general, there are no sex hormones in before adolescence. So in children, so there is prevalence of dry eye, or you have not reported it?
Yes. And naturally, it's a very good question. Naturally, that the reflux is governed basically by cholinergic response. Cholinergic response that governs the control, that controls the tear film secretion. So usually the basal secretion itself is very high. In case of in case of the before adolescent stage, the basal secretion is very high. It's governed by the cholinergic reflective response. The cornea is very, very sensitive for the changes which is happening in the eye. So the cholinergic drive makes it, the secretion increases up much more. But the influence of sex hormones, which is coming to picture in a little later stage. In a very young stage, probably that other glands, we really don't know. We have more than half a dozen of glands over there. As of now, we studied only meibomian gland. So we really don't know which gland is secreting what and what percentage, how is it increasing the tear stability, we don't know. But the mucus secretion, in case of mucus, we divide into soluble mucus and insoluble mucus. That is also present in the tear film. That gives a more tear stability. But in case if that is very high, again you get the same influence of artificial tears.
So you mean to say that in children we don't need that lipid layer?
I don't know. I don't know. This itself is now it's a first to this study up, and it's pretty open for other people now to look into other things.
Thank you, sir.
Sure.
Thank you, Dr. Thirumurthy. We request you to kindly receive the certificate for the Dr. VINOD KUMAR BHARGAVA Award.
Thank you, sir.